and we're here with Dr. Christopher Nicholas. Welcome, Dr. Nicholas.
Thank you.
Dr. Nicholas, could you share with us a little bit of your background?
Well, I'm an orthopedic surgeon. I've been in practice for about 15 years. Okay. Kind of local as far as my training. I did my undergrad down at Wayne State, and then my medical school training at Michigan State, and then my residency. So yeah, it just keeps going.
Okay.
So that's another 5 years of training, and that was somewhat local too, primarily in Pontiac, and then through some of the other hospitals in the area, primarily as part of a consortium with Michigan State.
Okay.
I started out in practice in a larger group, more over by Auburn Hills, and then more recently I've moved closer to home. I'm from Macomb County and coming home to my roots.
Well, welcome back.
Thank you.
So your area of expertise is joint replacement and knee replacement. Could you share with us, or with our viewers, some of the knee pain that require medical attention?
Sure. So, and that's a common question for patients, should I be seen? Is there something I can do? And I think the first part of that question is, are they making the right assumption, or is it just an assumption? Have they been diagnosed with arthritis, or is this something that they think that's what they are? And they may or may not be right. If you haven't had an actual confirmed diagnosis, and this is something that's been going on, it's not just there for a couple days, this is a real nuisance, it's affecting you, it's changing you, it's certainly appropriate that you see someone like myself or someone else to confirm, are you on the right track?
Okay.
It may be something else that we have other options for. If you do know it's arthritis, then it's a matter of how much is it affecting you? And again, it may be someone like myself that spends a lot of time looking at all the different options and being able to educate you about those, or look for solutions. And it doesn't mean surgery. Sometimes it does. There's a lot of other things that can be the right answer for you. And then again, that's where you need someone like me to talk with you.
So what would some of the solutions be before you actually had a surgery?
Sure. So in the case of joint replacements, what arthritis is, you're wearing out the joint. So it's going to be usually a gradual progression. So there's a lot of things that may be able to control your symptoms adequately for you without actually literally replacing that worn out joint. Okay. It may be the use of anti-inflammatories, there may be therapy, bracing, different types of injections, either steroids or there's other forms of injections now that can be very effective for people. So it's really kind of getting a baseline. Where are you at in the progression of this disease? What things have been attempted? What fits right for you? And it's not going to be the same answer for every patient. So that's where, again, that talking really comes in at first.
Okay, I understand that completely, being that I've had some knee surgeries in the past myself. How can one avoid knee surgery? I know sometimes when we get up in the morning, we'll hear a pop,
right,
maybe a lock here and there,
right,
and we might wait and just put ice on our knee for a little while, and then the pain is still there, and then we'll come and see an orthopedic surgeon.
Right.
At what point does knee surgery kind of come into place?
So I think it depends a little bit on what the conclusion of what is the underlying source to your problem. So if it's something that's more structural in nature, a tear of a cartilage or something that's catching, flipping, causing that locking type of symptoms that you described, well, that's a physical problem that probably needs a physical answer to it. And then surgery may be something that we would discuss much earlier in the solutions for you. For a lot of people, whether it be arthritis or even other conditions, it may be causing inflammation, causing pain, but maybe one, it has an opportunity to heal. Or if we can control the symptoms right now through lesser means, maybe it isn't that problematic for you. So it's being educated and having the right assessment to figure out, is it safe to wait? Is it going to get better potentially, or am I just putting off the inevitable?
That makes sense. So if you are in need of knee surgery, what are some of the what can you share with our viewers to tell them, this is what type of surgeon you should be looking for, and the characteristics of that surgeon that you would want to operate on your knee?
Right. I think probably the first thing you have to think about is, am I comfortable with that person? And if you're not, it's not a good mix for either one of you. It's a big deal. Even what we might consider somewhat minor surgery, like an arthroscopic procedure, which is an outpatient type of procedure where we use little cameras and small instruments, we may consider it somewhat minor, but it's not minor when it's being done on you.
Correct.
So regardless of the extent of what that procedure is, you want to be pretty comfortable with that person that's going to do it. And the recommendations they're making, do you trust them? That's number one. I think another thing that I really value in a physician, if I'm going to seek that help, or if I am that physician, is doctor means teacher, literally. And so part of my job is to teach you. I'm not going to make you an orthopedic surgeon in 5 minutes, but I'm sure going to try to help give you a better understanding of what your problem is, what are your options, because part of my job is to educate you so you can make a good decision for yourself. And it's not always going to be the right answer for every person. So it's not black and white. Medicine's a lot of shades of gray.
Absolutely. Would you say that when your patients do come and see you, are they pretty compliant? Do they, when you tell them that they might need knee surgery or even going to see a physical therapist, do they listen and do what's right, or do they put off the knee surgery?
Well, I think that patient is going to be the same as what you encounter in many other things in life. They're going to be along the whole gamut. Some are going to be very compliant. They completely buy in to what you're selling. Some are going to be more resistant. I guess that's human nature. We can all think of occasions in other different parts of life where we've seen similar things. I think coming back to, if I can educate you better as to why things are important, why that therapy or the way we're going to do things is important, it's a lot easier to accept. It may not be fun. It's work sometimes. It's kind of like if you're a parent. If you just tell your child, do this because I said so, hopefully they still will. But if you take the time to explain this is why, or here's the consequences, or here's what you can get out of it, I think your odds go up that they're actually going to be more compliant and they're going to see it through. And they're going to do better, and you're going to feel better about it.
Absolutely. And you mentioned some of the solutions being injections. Are there certain injections that are better than others, or does that depend on the type of patient and what the problem is with the knee?
It does depend a little bit on what the problem is and what you're trying to get out of that. So most commonly when we say injections, what most people think about is steroids. They say a cortisone injection, and that whole class of anti-inflammatories. And that's really what a steroid does. It's a strong anti-inflammatory effect. We know people use steroids for asthma. Everyone's like, oh yeah, of course. Well, that's an inflammation in the lungs, and the steroids doing it. So it's the same concept. So we take Motrin or these types of medicines to reduce inflammation. This is a stronger effect directed right to the area. So it can be helpful, but it's for more that acute inflammation and trying to reduce that pain. The problem is it's a lot of times not going to be sustained over long periods of time. It may be a temporary fix if you have a fairly advanced arthritis, these things. Sometimes it's part of a solution, getting past a point in your recovery for some injuries. And then there's other types of injections. The active ingredient is called hyaluronic acid, which is part of what our cartilage is made of. And there's a bunch of different companies that make them with some good results with them. This is more for arthritic conditions specifically, and the knee primarily. The appeal of those is when they do work for someone, they work for a much longer duration. The hope is 6 months or more of relief from these. And the other thing that I find really appealing for those versus a steroid is one of the things we worry about with steroids is they may cause softening or weakening or damage with repeated injections. We haven't seen that as being a concern with these types of injections. So as long as they're working for you, it's a great solution that maybe that's where I'm at for now.
And certain age groups, we have our athletes, our high school athletes, our collegiate athletes, and then we have your age group after college.
Right.
That we might go out and play basketball with a friend, hurt our knee, and maybe a little bit reluctant to come and see an orthopedic surgeon. At that point, what are you seeing at that point? A lot of the knee injuries that you may see, is it more ACL repairs or meniscus repairs?
There may be some of the same injuries that you see in that little bit younger population. So you're referring to what we commonly call the weekend warrior.
Right.
And I'm an advocate for it. Be active. You know, it's part of quality of life as well as being a little bit more physical. But because you're only the warrior on the weekend, our ability to recover sometimes isn't as good as we get older. It's the reality of life. And maybe we become a little bit more deconditioned. So some things is, preparing. Sometimes warming up and stretching maybe has a little bit more role as we're a little older than maybe the need was when we're younger. Getting into exercise routines on a regular basis, working on both your flexibility and your strength so that you have a good support around that knee in what you're doing. Be realistic. Sometimes it's realizing that I'm not 20 anymore as much as I want to be. Right. But I'm not saying don't be stubborn about that. Yeah. That can be good. And you want to stay active. And it's realizing that it's okay to wait a little bit. I can understand you being reluctant, and you don't have to rush to the doctor as soon as something hurts. But when it continues and it's affecting you and it's clearly there, come see me. It doesn't mean surgery. I got a lot of options probably for you. And I think that's where some reluctance is too, is like, how do I fit this into life? And yeah, sometimes it can be a little bit tough, but don't assume too much.
Well, we certainly appreciate all of your advice and even offering the time frame of when the viewers need to come and see you as well, or an orthopedic surgeon as well. We appreciate your time today, and thank you again for coming.
I appreciate the opportunity, and thank you.
Thank you. Thank you.
For more information, visit mclaren.org/Macomb Ortho.